Today I will talk about osteoporosis. Osteoporosis or osteopenia is a common clinical syndrome involving multiple bones in which there is quantitative reduction of bone tissue mass, but the bone tissue mass is otherwise normal. This reduction in bone mass results in fragile skeleton, associated with increased risk of fractures and consequent pain and deformity. The most common forms of osteoporosis are the senile and postmenopausal types. Clinical features. The clinical manifestations of osteoporosis depend on which bones are involved. Vertebral fractures that frequently occur in the thoracic and lumbar regions are painful, and, when multiple, can cause significant loss of height and various deformities, including lumbar lordosis and kyphoscoliosis. The immobility following fractures of the femoral neck, pelvis, or spine results in complications such as pulmonary embolism and pneumonia, accounting for 40,000 to 50,000 deaths per year. Morphology. The hallmark of osteoporosis is histologically normal bone that is decreased in quantity. The entire skeleton is affected in postmenopausal and senile osteoporosis, but certain bones tend to be more severely impacted. In postmenopausal osteoporosis, the increase in osteoclast activity affects mainly bones or portions of bones that have increased surface area, such as the cancellous compartment of vertebral bodies. The trabecular plates become perforated, thinned, and lose their interconnections, leading to progressive microfractures and eventual vertebral collapse. Treatment. The prevention and treatment of senile and postmenopausal osteoporosis includes exercise, appropriate calcium and vitamin D intake, and pharmacologic agents that decrease resorption. Bisphosphonates. Bisphosphonates reduce osteoclast activity and induce osteoclast apoptosis. Denosumab, an antironcal antibody that blocks osteoclast activation, has shown promise in treating some forms of postmenopausal osteoporosis.